Welcome to Doctress. This is the space where we dwell into the journeys and the insights of those in the field of medicine. Ma'am, what was the defining moment that made you choose oncology over all specialties?
This story might sound a little silly.
That's okay.
So, during my MBBS days, weirdly, I was very interested in community medicine.
Okay.
Maybe it is from my father's side. My father is also into public health, a lot of things.
You know, this is a surgical field, and a lot of women taking up surgical field, it's almost like a taboo thing in medicine.
Recently, I've been to Europe for getting trained in high-tech.
Okay.
So the surgeons there, women surgeons were very big people, like from all over the world. And all of us were, we had to change into OT dresses, scrubs. We were going there for some training. And same thing. Men had nice changing rooms, and as women, we got washrooms to go and everybody there. We forgot about the hierarchy, we forgot about the differences. All of us were bitching about the same thing. Why are we in the washrooms?
So, ma'am, is cancer really about like genes and lifestyle, or are we just like, or oncologists just lying to the patients?
So what I say is, if I see 100 patients of cancer patients, less than 10 will be some family or hereditary related. Remaining 90% are random. It can happen to anybody, you, me. And if I say random, anything can happen, it doesn't mean that you can just have whatever lifestyle you want.
Is there something else that you want in the future? Like you want this technology to come up in the future?
Let me think.
Like something that you've just dreamed of. That
Yeah,
you wish
work from
AI
home.
Okay.
Work from home. Being a surgeon, so that has been happening too.
Okay.
So I want to take a vacation somewhere.
Yeah.
Operate from there in the console, and then that robo is here, and maybe somebody else is there to guide robo. Robo is not gonna be alone. Definitely there's a trained surgeon there, and then I can take vacation and at the same time operate like all the software employees are doing.
You never know,
I'm
ma'am.
so jealous of them.
You never know, ma'am. AI is now emerging, so you don't know. It might come true. It might.
Yeah, hopefully. Fingers crossed.
Hi, welcome to Doctress. This is the space where we dwell into the journeys and the insights of those in the field of medicine. And today we have a very special guest with us today, Dr. Bhavya, ma'am. Ma'am, hi.
Hi, Dr. Sweta.
Hi, how are you, ma'am?
Good, and thank you. How are you?
I'm good, thank you, ma'am. So, ma'am, would you like to introduce yourself a little bit? Tell us about what you do and who you are.
Yeah, definitely. So, as Dr. Sweta introduced, I'm Dr. Bhavya. I'm a surgical oncologist. Right now, I'm working at KIMS Hospital, Gachibowli. I'm a consultant there. So, I finished my general surgery from Osmania. And then I finished my surgical oncology super specialty from SWIMS Tirupati. And I specialize in peritoneal surface malignancies, HIPEC and PIPAC. And see, surgical oncology covers head to toe. So it's more like we cover almost all organs, but I leave out brain. We don't touch brain, spine, and that's it. Pretty much every other part we operate.
That's so great, ma'am. Okay. So, ma'am, what was the defining moment that made you choose oncology over all specialties?
Okay, this story might sound a little silly.
That's okay.
So, during my MBBS days, weirdly, I was very interested in community medicine.
Okay.
Maybe it is from my father's side. My father is also into public health, a lot of things. So I don't know, I have some of that influence. Right from second year, I was interested in community medicine. And I was the only one who was interested in community medicine. But then to pursue it as a career in India, right, at that time at least, it was not very lucrative. And then I thought surgical oncology, see, it has a lot of community side. You have preventive aspects. You have lot of things which go into the education awareness. So I do a lot of campaigning. I do cancer screening programs. So that is how I chose surgical oncology in general. And maybe I didn't want to limit myself to an organ, which generally happens with surgical gastroenterology, neurology. It's all organ specific.
Yes, that is.
And general surgery, I don't know. It was almost like I always want to cut and stitch. That was my okay. So I've always wanted to cut and stitch. So that is how general surgery was one of the options. Initially, I even considered OBG because it's had cut and stitch part.
Yeah.
But then it is not my cup of tea. So finally, I landed up in general surgery. And then, as a lot of others, like few of them suggested me to go ahead with the ops, which was a very women-specific branch at that time. I don't see anything wrong about it.
Yeah.
But then, no, that was not what I wanted. I wanted to be a surgeon, and then surgical oncology came ultimately because of both the aspects.
Yeah. Yes. That's basic. That's a really nice story, mom. And yes, with OBGYN, that is like a very sought out specialty with a lot of women, and people expect you to do it. But it's so nice, mom, that you chose something so like it's very concentrated. It's a very intense field. It's really amazing that you chose that, mom. So with that being said, this is a surgical field, and a lot of women taking up surgical field. It's almost like a taboo thing in medicine. So how do you deal with that, ma'am? Like, what has been a big challenge being a woman in surgery, and that too in oncology?
Yeah, it is definitely difficult for women to get into surgery. This was 10 years back, not now. Because I see a lot of women in surgery and all other branches right now. If you take maybe MBBS itself, there are a lot of women. Lot of women everywhere, 70% it's women.
That's
So the
true,
branches are
yes.
full of women doctors. So my scenario was very before.
Yeah.
And yeah, it was very difficult. There was a lot of opposition. People were suggesting me not to take general surgery and all. But the main part, my parents were very supportive, and then my husband luckily was very supportive. The challenges being are common for anybody who's starting out new in the field. So it is, you can take it positively that the system is not trained to accept us yet. We are new.
Yes.
So initial challenges were very simple, like see, maternity leave was an issue.
Yeah.
I was very, there were very lot of repercussions when I took leave.
Yes.
And whether to, how long to take the leave for. That was the main issue which I had. So whether to come back and give exams or just take leave and take care of my baby and come back, and then being a surgical oncologist, our surgeries are a long-standing surgeries. Like see, whenever we wash around for 7 hours, 8 hours. A lot of days it used to happen, at least in residency.
Yes, ma'am, that makes sense.
And I cannot breastfeed and take care of my work together.
Of course.
That was not possible, unlike other branches.
Yeah.
See, if you're doing some other, you can come out in between. At least few of my friends managed doing that.
Okay.
But then I figured out that no, I'm not going to run anywhere, right? Ultimately, I'm going to be there. So I took off peacefully. This was especially guidance from my seniors and my HOD especially. He guided me really well. You're not going to run. You're young. Why are you want to come back?
Yeah.
So yeah, I stayed back, and then I finished, took maternity leave, took care of my kid, and then joined back. And the other issues, it is on us too. Like we generally have higher standards. We do not want to show weakness, so we work more than others.
Very, very
so
true.
we don't want someone else to point out that you cannot be in this branch. If you compare a male counterpart, automatically you take little pressure on yourself. We didn't even have a changing room when I was there. In my first year, there was no changing room for women at all.
Oh, wow. Okay.
And recently, I've been to Europe for getting trained in high-tech.
Okay.
So the surgeons there, women surgeons were very big people, like from all over the world. And all of us were, we had to change into OT dresses, scrubs. We were going for some training. And same thing. Men had nice changing rooms. And as women, we got washrooms to go and everybody there. We forgot about the hierarchy, we forgot about the differences. All of us were bitching about the same thing. Why are we in the washrooms? So there are a lot of things which were difficult before, but then over time I have seen a lot of change happening. Finally, when I was in third year, I had exclusively a room to myself.
Wow.
There were nobody to share with. So I was all alone.
That's how it should be, ma'am. That is how it should be.
So yeah, there are some difficulties, including the part where I was shocked was you are generally not employed when you're pregnant.
Yeah.
And maybe because you're like surgeon. If I was in that management position, maybe I would have done the same thing. I don't know. I'm still confused. These are some issues which are not like very bad things to deal with. It just points out that you're a woman being in a surgical oncology department. But then it has settled. I said there are a lot of plus sides too, which I would love to share if you're interested.
Yes, ma'am. Yes, that was my next question actually. So of course, there's two sides for everything, and as there's challenges for everything, but there's also some plus sides and pros. So how is it? How has it been like a surgeon, like a woman surgeon in this field, like the superpowers that come with this job?
So one was wherever I was there, at least. So I'm the thing is right now I'm discussing about what happened 10 years back, which is not the scenario now. When I was there, I was the only female surgeon amongst some 20 students or something at that time, and then I was treated like a princess. In fact.
Okay.
That was even I was pampered. I'm not saying there are perks of being a single specialty person. And yeah, as a woman, you understand what other women want better.
Yes.
See, the way we understand breasts, the way we understand uterus, the way we think about our ovaries, and the way we understand about menopause. Lot of people just take out ovaries irrespective of age, but the way we understand what happens after you remove ovary is very different. As a woman, we bring that perspective. It is not something which has to be taught from somewhere. It is right inside you. So your clinical decision makings will have that impact on your decisions. And yeah, there are a lot of patients who wait for you exclusively. There are a lot of women who come all over. I mean, they travel from a lot of other places to come to meet a female surgical oncologist exclusively. So those are the perks. That's it. The rest of the things are same for everybody, I feel.
I really like that, ma'am, how you put that like perspective, because I never really thought about, like you were living through your own life experience, like you're putting your own life experiences clinically, and that's really amazing. I think that's really, I like that. I like that perspective.
And yeah, being a woman, something else which actually helped me a lot was becoming a mother. So there was a lot of difference before. See, whatever women surgeon, everything before motherhood, everything is the same. You're same. Everything is the same. But then once you have kids, something which helped me clinically was, because I manage my two high energy babies, they're like high energy balls roaming around, and then I have to pamper them, scold them. You call those in Telugu, you say a lot of things like. So the same thing, now I am able to convince my patients better. My patience has increased towards my patients. I can see them and then see that, okay, I can handle them. Whatever they do, whatever tantrums they throw, I don't lose my cool very easily. That is what has helped me a lot. This part I don't think I would have achieved if I was.
That's so amazing, mom. That's so cool. So I mean, you answered this a little bit, I think, already, but like again, this is a very demanding field as it is. So how do you manage like work-life balance? How has it changed over the years, or has it changed, or have you just always been really good at it? Is that why you chose this field? And you're like, okay, I can do this, like,
To start with, all of us will feel like superwomen. That is the inherent. We are high achievers. Obviously, when you're choosing something which is not already done, your energy levels are high, and the thought process is also different. You think you can do everything. That was the same thing which happened to me. So I was managing really well, and then I had baby. Initially, surgical oncology was also, I was hesitating, but then my husband said, yeah, I'm there to help. My father said, yeah, I'm there to help. So why don't you? So I picked up a branch, and then they were the backbone. And now if I'm able to sit here, relax peacefully, it is my husband who's managing my kids back there. And my parents, my mother-in-law and father-in-law, it like takes an army for me to come out and sit. So initially, balance was something which I was confused to. I was thinking how to balance. As I said, you're always very ambitious. You wanna reach the top. So I was working almost 9 to 9 every day, and by the time I went back, I have no energies left out in me. So slowly over time, I think this is not taught. This is learned from something. So you understand what you want exactly in life. Especially when your peers, there are a lot of friends. Luckily, I have very good friend network. You talk to them, you sit with them, and then they guide you, and then you understand that there is no way that everything can be balanced. So I have seen a lot of interviews from very successful women too. So it is more like, what is the balance today? It is not every day.
Taking it one step
Today, I want to give importance to my family. I do that. Today, I want to give importance to my work. I give that. today, if I want to give importance to myself, just go relax in a spa, take a vacation, whatever,
Yes.
I do that. So now for me, the goal of work-life balance is per day. It is not for the whole life. That planning is gone out.
Yes. So it's basically taking it one step at a
Yeah,
time.
yeah.
Only one step
Every
at
day
a
is
time.
different.
Yeah, every day it's different. Every day is a challenge. I mean, you start off young, but then the energy gets
Yeah,
drained
we were
over
not,
time.
I was not this before 5 years. I'm a different person now.
Yes.
So I have different requirements.
Yes, well, that's there. So, ma'am, let's go into the cancer landscape a little bit here. So, there's like a lot of narratives out there. You know, some are like maybe empowering, but then a lot of them are like misleading, right? So, ma'am, is cancer really about like genes and lifestyle, or are we just like, or oncologists just lying to the patients? Like, what is it? You know, the behind the scenes of, I guess, behind the
Yeah.
scenes of oncology.
So as I said, I do a lot of awareness sessions.
Yes.
And then yeah, lot of people, the same question is asked by many people, same thing. How do I know if I am that high risk person? So to explain this scenario, I give them an example. See, you know a 20-year-old lady who's not married, and there's a 25-year-old newlywed lady.
Yes.
And then there's a 40-year-old woman who was married, who has 2 kids.
Okay.
And then there's a 70-year-old old grandma with everything.
Yes.
So they don't have any family history. They don't have any bad lifestyle habits or something. So who do you think is the person whom we can think that they can be cancer free? So you don't have to worry about them. Who do you think is like, you can choose one option amongst these so that I can answer your question.
Maybe the youngest one?
Yeah, that
Because
goes.
like, they're not married, they don't have anything, their parents parents that look after them.
So that is true. When we see, like when you go when you read in the books, that is what your attitude. When you read in the books, you read about the percentages.
Yes.
See, you say that at a particular age, this cancers increase. That is a percentage of. You're talking about the maximum number.
Yeah.
But when you deal with the patient in real life, that 1% is 100% to them, and that 1% is 100% to us. So we cannot specifically say that you're risk free.
Yes.
So definitely genes, genetic, we all know there is a Jolie syndrome, and then there's BRCA, there's a lot of hereditary genes, for which lot of queries also come regarding genetic screening, genetic testing. So what I say is, if I see 100 patients of cancer patients, less than 10 will be some family or hereditary related. Remaining 90% are random. It can happen to anybody, you, me. And if I say random, anything can happen, it doesn't mean that you can just have whatever lifestyle you want and you think that anyways it's gonna come. So why am I supposed to be healthy? Why am I supposed to eat healthy? Why am I supposed to stop smoking? Why am I supposed to not, drink too much? And why am I supposed to exercise? So these are the questions which people might raise. Definitely your risk reduces. So the one why I'm sharing this part is because a lot of patients, when we say that you have cancer, the first point they start was, why me? Why am I the one affected? There are sometimes like, I have good health style, I don't do anything. What is that exact? They're trying to look for a reason. In a way, I feel it is like blaming you. So even if you find someone with a health problem or something, so your relatives just randomly will say, maybe I told him not to do that. He was having junk every day, and that is why he has developed. So you hear this a lot. So now the community is blaming you for getting a disease. So and then you start. So it is not a blame game. Definitely good health style, and definitely everything else is screening procedures and all will help you. But at the end of the day, everybody is equally at risk, and the patient is not to blame. So I suggest younger patients also to just keep an eye out, because especially in India, cancers in young are on the rise. We don't know the reason yet, but definitely they're on the rise.
So it's just about taking care of yourself.
You just have very simple things. I just tell patients, as I said, what is that? How is that we identify that we have cancer? So I just tell them simply, anything in your body, anything abnormal, if it is persisting for more than 3 weeks, 3 weeks, let it be just bloating sensation, indigestion, hiccups, or some lump which is
Yeah.
painless. Most of the
Yes.
times that is ignored.
Yes.
So anything, consult a doctor. If the reports turn out to be negative, that is good.
Yes.
But that part of not neglecting any health problem for a long time, it is more like you know your body. You know that
Yes.
this is normal for me.
Yes.
And if something is abnormal, your body will already indicate you.
Yeah.
It is very minor also, but you just can't neglect anything minor for a long time.
For a
That
long
is what you have to do.
I mean, it's better to be careful than,
Yeah,
you know,
just don't be
than
afraid,
being
but be
negligent.
cautious. That's
Yes.
all.
Yes. So, ma'am, okay, so this, you've cleared like all this stuff, you know, about taking care of yourself and everything. But social media is on the rise now. Internet is like the go-to place for every young person to search up an answer, including even health problems. I've seen my own parents search up health problems on the internet. So there's a lot of misleading information. There's some good information, but also misleading information. So, ma'am, like, what is one health myth that you've heard in this field that, like, every time you hear it, you just want to say, like, stop, please don't listen to this, you know?
Yeah.
Like, do this instead.
So Sweta, if you want me to tell one, it is very difficult because these days I have seen so many. Like recently I saw some video. This was after we have a mobile bus which goes to right at your
Yes, yes, I've
footstep,
seen that
and
one,
then
yeah.
it does breast digital mammography.
Okay.
So after a camp in a very huge community, some people sent me a message saying that this video, saying that your breasts are like oranges. And then you crush them in between the paddles, and then that causes cancer. This was one thing. And then there was somebody else saying you do exercises, arm exercises, and then you don't get
Yes.
cancers. And then very common myth is wearing a bra at night or some padded bra or white bra can cause
Yes.
cancer. It blocks your lymphatics. And biopsy spreads cancer.
Yes.
And there are even people who don't eat sugar at all, saying that your body, your cancer feeds on sugar. See, as in general, your body needs sugar. And then cancer, maybe because it's too active,
Yes.
it will take up more.
Yeah.
But then you cannot starve your body of sugars, right? Sugars in the sense calories. So there are people who are like absolutely doing no sugar. So you can't stop me here. I have so many. So I can.
It's
I don't
okay, ma'am.
know.
I think the viewers would love to listen to all these because it's high time that people listen to the right information from a trusted source rather than just looking at the internet and, you know, Googling whatever the thing that they want to.
Yeah, I do get a
Google.
patient saying breast pain, and then finally when you sit with them, talk with them, and slowly they reveal that they have been hitting themselves to prevent heart blocks.
Okay.
Seriously. And then that is how they landed up with breast pain. So these are all these are all the things which are happening.
Yes. It's okay. So, I mean, ma'am, like, so there are a lot of medical professionals like now making a platform on social media because that's the new thing, right? You need to make a name for yourself. Do you agree with that, ma'am? Like, do you think more of that should be there or less of that should be there? Or if that's like adding on to this misleading information? Because what if someone just claims to be a doctor but is not actually a doctor and then posting all this on the internet for young people to see and follow? Or even older the generation, like my parents' generation or my grandparents' generation, they know how to use WhatsApp, they know how to use Instagram, all of these platforms. So what do you think about that, ma'am? What's your opinion about that?
So, Dr. Sweta, if you know about gardening or something,
Yes.
when something healthy, some healthy plant doesn't occupy the space which is available, there's a lot of weed that grows around. So, I personally feel that if as doctors, as professionals, because there is a need, there are people who want information at the click.
Yes.
They want, I get a lot of Insta messages, requests asking me for them for consultations, advices. There is a need, there is a requirement. People are looking out for answers. People are health conscious. That's a good sign. So that has made a lot of people who are not trained to give a lot of suggestions, as I have shared before.
Yeah.
So if as a trained doctor, if we don't take up the space and we don't educate them, it is not just about making a reputation for us. It is also our responsibility of educating. And if you're silent, whatever the misinformation gets spread.
Yes.
So as a doctor, I think you have to create that awareness and take that responsibility, and also have a disclaimer that whatever you just say something and then it is not applicable to everybody.
Yes.
It is a general talk. It is not a specific personal consultation that we are giving.
Yes. So, ma'am, going back to like a few questions before, so we were talking about the myths, right? So, let's just like zero in on women, okay? What is something that you would like women over 30 to know that's maybe like they believe, you said like the bra wearing or, the hitting of the breasts or something like that, all that stuff, what's something that you would just like to tell women over the 30s? One advice, like that you would want them to follow.
One advice, if like I have hundreds of advices, but one advice which is the topmost is don't postpone things. That is what happens most of the time. That is the ultimate culprit. See, you cannot a lot of times prevent everything. Things happen, as I said, but then when you know it, you have to act on it. There are people who say that there's renovation happening in my house, there's my daughter coming from US, there's like a lot of things. They just postpone things. And they think that they're helping family by not prioritizing them. So the only way for your family and yourself to be safe is when you're safe. So whatever complaints you have, don't think that it's wasting of your kin's time. Don't think that it is wastage of your money. Don't think it's of wastage of anything. Just go prioritize yourself and get checked.
Yes.
That's it.
That's perfect, ma'am. So, in this field, you've been in this field for quite a bit. What is something that's like, there are advantages, right? Every day there's more research, there are more technological advances. So is there something new that's been happening in this field that's helping patients more and more? That's something you would like to share with the viewers?
So something I am personally fantasized about is robotic surgery.
Okay.
So there are robots and then it helps you and the patients.
Yes.
It is equally good for the surgeon also.
Yes.
Robots doesn't mean robots are operating. It's we at the end of then who are controlling then and then we operate. But then it gives you such magnified view and such maneuverability and access to spaces where it is restricted. So when we do pelvic surgeries, if two of us are doing open surgeries, if one of them is saying we have to like put our head right inside to actually visualize and help. And then this assistant who sits behind, I generally tell them, don't try to look. If you look, I cannot see. So you just have to hold and not look at. But then in robotic surgery, everybody can sit, see everything, and everything is so magnified, beautiful. So to me, robotic surgery is a very good thing that has happened. And HIPAC and PIPAC, there are a lot of recent advances in cancer treatment. It has become personalized. It is not like we are treating cancer. It is very specific to a very person. Like you take the person and then you analyze what are the genes, what are the subtype, and then so the treatment is very tailor-made. In that way, the side effects are reduced and the effectiveness is increased.
Okay. Is there something else that you want in the future? Like you want this technology to come up in the future?
Let me think.
Like something that you've just dreamed of. That
work from home.
Okay.
Work from home. Being a surgeon, so that has been happening too.
Okay.
So I want to take a vacation somewhere. Operate from there in the console, and then that robo is here. And maybe somebody else is there to guide robo. Robo is not gonna be alone. Definitely, there's a trained surgeon there. And then I can take vacation and at the same time operate like all the software employees are doing.
You never know,
I'm so jealous of them.
You never know, ma'am. AI is now emerging, so you don't know. It might come true. It might.
Hopefully. Fingers crossed.
And so, ma'am, final question for the day, just before we wrap up. I'm a fourth-year medical student right now, so I know that college is very different from the real world. And just like me, there's so many students that are so scared to put themselves out there. So what is one advice that you would want to give to students like me, or maybe just like to your old self? What's something that you wish somebody had told you before you were sent out into the real world, from college to like navigating PG and fellowships and life? What do you wish you were told?
Something which has helped me in career and patient care and personal life is that empathy, which is generally not taught. I mean, not taught in the colleges, and over time we lose it.
Yeah.
We become so mechanized. It's a sort of barrier that we build around yourself,
That's
mostly to
true.
protect ourselves. So that part, when you sit and talk to the patients, whatever is happening, there are a lot of attacks. There are a lot of bad things happening on. I don't
There's
want to name
so
them.
much. A lot.
Yeah. So in order to protect ourselves and help patients better,
Yes.
the previous concept of family physician, where when a patient comes, you identify them by their name, even talk
Yes.
about their families, talk
Yeah.
about the generations ahead. You know,
Yes.
you go to their house functions.
Yes,
That
yes.
was a era where the rapport was there. There was trust.
Yes.
That was mainly because of time.
Yeah.
Because you give time
I
to them, sit with them, talk to
Yes.
them. And luckily, in my specialty, we have very less OP. I mean, our OP need not be like really high.
Okay.
Whenever we have surgeries, it's but then
Yes.
once a patient comes in OPD, I'm blessed to spend time with them. This is what I have learned over time, because initially when you're in training, you don't get time. You're like seeing 200 patients a day, 100 patients a day,
Yeah.
and you don't talk to them. It's more like diagnosis, treatment, check, next,
Yes.
next. I don't blame that part, because that is what was required there.
Yeah.
If I was slow there,
Yes.
the number of patients, the treatment wouldn't have gone to so many patients.
Yes.
So now whenever you have an opportunity, take time, sit with patients, talk to them, build that rapport. That's it.
So, that's basically it for today. Is there anything else you would like to add or just say?
If you want me to give one last message, I said the only thing I tell everybody is get screened. So once you're above 30-year-old, get a pap smear or HPV DNA testing once every 3 or 5 years. There are even self-test kits, even menstruating blood can be used. And once you're 40 and above, get a digital mammogram done once every year. Once you're 45 and above, get a colonoscopy done once every 10 years. And if you're a chronic smoker, low dose CT after 50 years. So these are in general screening protocols established.
Yeah.
And these are mainly for healthy people with no symptoms. That is what screening means.
Yes.
This is my ultimate message to anybody. That's it.
Thank you, ma'am, so much. Thank you so much for being here today, and we're so happy to have you. And thank you for sharing your journey and just sharing all these insights. And I hope that you keep doing all of whatever you're doing, because you're making a lot of lives better. And thank you for influencing the medical field. And it's been really great to have you.
Thank you. It's been really great to be a part of Doctress app, and Sweta, you are really so sweet to me. Thank you.
To everyone listening, thank you so much for tuning in to Doctress. We'll be back next week with another episode. Bye.